This subject talked about AV block and bundle branch block. Then we discussed also or talked about the sinoatrial disease or sick sinus syndrome. The conductive system starts from the SA node, then goes to the atria, the impulse goes to the atria, then to the AV node, then to the bundle of phase, then to the Purkinje fibers, and this video will show the propagation of the impulse from the SA node to the all part of the heart. AV block consists of three types, which is the first one is the first degree heart block, which manifested by only prolongation of the PR interval. PR can calculate the PR interval from the start of the P to the start of the R. This should less than or equal to the 0.2 seconds or 5 small square or more one large square. If more than one large square or 5 small square or more than 0.2 seconds, it is called first degree heart block. Fixed prolongation of the PR interval. It is rarely cause symptom or rarely need treatment. Another type is the second degree heart block, which consists of three types. Type 1 is the MOPS type 1, Winkie-Bach phenomena characterized by progressive prolongation of PR interval with a drop beat. Progressive prolongation of the PR interval with a drop beat. This is the drop beat, which is not caused or not followed by the QRS complex. There is a block. This is Winkie-Bach phenomena, and usually the block at the level of the AV node and not cause symptom. It is benign, not indicate the ischemic heart disease, and not need treatment. While MOPS type 2 characterized by fixed PR interval with a drop beat, not progressive. Fixed PR with a drop beat usually indicate extensive damage lower than the AV node, and this is a malignant type, and it is the manifestation of ischemic heart disease, and usually cause symptom, and so symptomatic or asymptomatic, it need treatment by pacemaker because indicate the extensive damage of the Purkinje system below the AV node. Third type of the second degree heart block is the 2 to 1 or 3 to 1 or 4 to 1. 2 to 1 يعني 2 P wave to the QRS complex, 2 P wave to the QRS complex, or 3 to the QRS complex. This is the another type of the second degree heart block, usually indicates ischemic heart disease and usually cause symptom and need treatment by pacemaker. Another type is the third degree heart block, when there is complete dissociation between the atria and ventricle. كل واحد يشتغل وحده، ماكو أي علاقة بيناتهم، فالاتريا يشتغل وحده والventricle يشتغل وحده. there is complete dissociation between them، بما إنه راح يصير كل من يشتغل وحده فممكن نلقى P wave على ال QRS complex. فمن نلقى P wave على ال QRS complex with in patient with bradycardia it is complete heart block until proved otherwise. P wave موجودة، بنحسب ال P to P rate ما يعادل ال R to R rate اللي هو ventricular rate ما يعادل ال arterial rate. وهذا ال causes مالته different, maybe congenital in patient with SLE يطلع للبيبي عنده congenital complete heart block due to anti-RA and anti-RO antibody، و maybe associated with other syndrome اللي هي associated with aortic valve sclerosis, ASD, mitral valve stenosis، وهكذا many syndromes congenital may be presented with complete heart block. Acquired maybe due to fibrosis, maybe due to ischemia or AMI, maybe due to inflammation such as infective endocarditis, cause aortic root abscess, or maybe in chronic inflammation such as in sarcoidosis and Shaker's disease, or maybe trauma such as in cardiac surgery ممكن إنه يضرب البيركنج system أو البندل أو ال AV node وcan cause complete heart block, or drugs such as digoxin beta blocker can cause a type of complete heart block. عندنا فد attacks or manifestation with complete heart block اللي يسموه stokes Adam attack when there is sudden loss of consciousness that occur without warning بدون ما البيشنت يدري ايش راح يصير رأسا sudden loss و result in collapse. طبعا المونيتور يقرأ تقريبا cardiac arrest ومن عبان البيشنت died وبعدين نبدأ نحضر إنه الريسستيشن والسي بي ار ويبدأ البيشنت بيت ويرجع إلى اللي هو بالسكند ديجري أو بالكمبليت هارت بلوك راح يرجع نفس البلوك وترجع البيشنت بدل ما كان ديد لايك سيفير بيلر راح يرجع يصير فلاشينج ويرجع هوت وكأنه شيء لم يكن. هذه تشبه السيزر should be differentiated from the fit or Caesar, but the Caesar عادة تكون associated with cyanosis وال يعني abnormal movement, urine incontinence, tongue biting, والريكفري بالإبليبسي يكون slow بينما الريكفري هنا يكون rapid within the seconds. Management تنقسم لها management of the AV block complicating the MI and chronic AV block. إذا complicating the MI and إذا complicate the inferior MI راح ممكن يكون transient ممكن إنه ما يطول أيام وبعدين يرجع فممكن ننتظر إذا كان asymptomatic. If symptomatic can put the temporary pacemaker and wait the patient for 7 days. If no response then goes into the permanent pacemaker. أما بالانتيروسبتر أو anterior أو anterolateral MI البيشنت هنا لازم نشيل له permanent pacemaker سواء إنه نشيل له temporary وبعدين permanent أو رأسا نشيل له permanent سواء كان symptomatic أو asymptomatic. أما بالchronic AV block إذا كان congenital not need treatment unless become symptomatic. أما بقية الcauses فهي correction of the cause. If not corrected and patient symptomatic patient can be treated by pacemaker. البندل branch block هي type of the block but هنا البلوك راح يصير عندنا either بالleft or بالright. فإذا صار بالleft سميناه left bundle branch block أما إذا صار بالright سميناه right bundle branch block. وطبعا بالleft bundle عندنا posterior fascicle و anterior fascicle ممكن يصير عندنا left anterior hem block and left posterior hem block. ال ECG هذا يوضح two types of block presentation or manifestation on ECG. نشوف ال left bundle إنه RSR pattern lead 1 and V5 V6 while broad deep S in V1 عكس ال right bundle اللي يكون RSR pattern in lead 1 and in V1 and V2 وال broad S in lead 1 and V6. The causes of left bundle branch block عادة indicate ischemic heart disease, left ventricular hypertrophy, aortic valve, cardiomyopathy, hypertension, and many causes. While in the right bundle branch block can occur in normal variant, can occur in ischemic heart disease, can occur in pulmonary embolism, in chronic obstructive pulmonary disease, in ASD, and other causes. طبعا left bundle or right bundle only manifestation on the ECG, not cause symptom. It may indicate the underlying disease. left bundle هذا نشوف ال ECG نفس manifestation بال lead 1 will be 5 V6 RSR pattern M shape while broad S in V1. And right bundle show broad S in lead 1 and V5 V6 while RSR pattern in the V1 and V2.